Equipos de Biomedicina de México SADCB, with more than 20 years of experience in the manufacture of high medical products, has the pleasure of presenting the technique of put the peripherally inserted central catheter (EBPIC) with the support of the Department of Neonatology from the Mexico Children's Hospital Federico Gomez. The EBPIC catheter material is 100% radiopaque silicone. This material has been associated with the decrease of risk in infection and thrombosis. You must select the appropriate vein to avoid unnecessary punctures. It's indispensable previous of the procedure to put the chassis to avoid the mobilization of the catheter posterior of the insertion. Considering the characteristic of the patient, this one must set without compromising the breathing. It's indispensable continuing monitoring the signal below. We suggest an extra supply of oxygen. It's necessary to determine the catheter length from the insertion site to the insertion of the second intercostal space with a mild clavicular line. Don't forget the continued monitoring of the vital signs through the procedure. The preparation of the initial equipment with the material heparination. We recommend using an heparin unit for each ml of the psychologic solution. Please verify sterility condition of the mini equipment. Each mini equipment has a tape measuring an AVP catheter of 2, 3, 4, or 5 French, an insert cut or introducer and dissecting forceps, specially designed to facilitate insertion of the catheter without damage or breakage. Manufacture of the catheter fulfill with the most stringent international quality standard. You must verify the joint of the insert cut component or introducer. The catheter will purge with the solution previously prepared, always using syringes with capacity of 5 or more ml, which avoid the tear or damage. Even we must heparinize the insert card or introducer. We recommend use sterilized files, use face masks, bond, surgical gloves, and double sterilized glove for antisepsis. You could use chlorhexidine and jodoprone to 10%. This product covers the entire length of the risk of mobilization of the sterile file of the selected area. Contamination and the possibility of require another puncture. You must retire the surplus of antiseptic for the possibility of a cutaneous absorption. To the end, you must remove the contaminated gloves. Immediately proceed to put the sterilized surgical file with the help of a guns holding the distal strip. Corroborate the leg to introduce it. Put the manual tourniquet or with the sterilized ligature and verify the vein with an angulation of approximate 30 grade. Insert the insert card or introduce it in the vein. Confirm the access to observe the return of the blood for the needle chamber. Retire the tourniquet. On the skin, hold the next part of the insert card. For prevent blood loss and retire carefully the needle. Keep extended the strip. With the forceps of the mini equipment, introduce carefully catheter with the discerned leg without forcing and try. For avoid that the catheter take a direction cephalic, we recommend during the fixation of the patient turn the head to the side of the tip to puncture. Holding the catheter on the skin of the patient, take off the shirt. Detach carefully the plastic shirt using the wind. You could use gentle twisting movement. Verify the venous returning aspirin with a 5 ml string. Before then, set the catheter. You must corroborate the calculate leg. For the third, you must to hold on his place in spiral form. First, set the wind to the distal part of the catheter. After, put an sterilized transparent adhesive patch. To the end, cover with an adhesive in tie form, holding the distal stream of the catheter. Put the ID level with date, hour, and name of the person who put it. The catheter fixation guarantees that the catheter will stay in the right place. It's important to keep sterilized the catheter axle on to define the use which will give it. Verify the location of the catheter tip by an radiation monitoring, which must be in the SBC as a junction with the right atrium.